Hello students. Today let me introduce into one more topic, that is the temporal and infratemporal fossa. This is Dr. Yusuf signing from Al Jouf University. These are the two specific objectives which I will try to cover. The first one is describe the boundaries and contents of the temporal and infratemporal fossa. Second is name and identify the muscles of mastication within the supply and actions. To begin with, the temporal fossa, it's a area or a region which is in front of as well as above the external ear. This is the external auditory meatus or the auricle. So just in front of the auricle and above the auricle, in front of the ear as well as above the ear, whatever structure is there, that area and that region is called as temporal fossa. So it's the region on each side of the head, above and in front of the auricle. So this is the region, this one above, and here it will be the front. Okay, so what are the boundaries of this temporal fossa? Superiorly we have the superior temporal lines. Okay, if you can see here on the skull outside, there are two lines here. One is called as the infratemporal line, then one more is the superior temporal line. So it extends from the superior temporal line, and in the front it will extend up to the frontal process of the zygomatic arch. So this is the frontal process of the zygomatic arch. This is the zygomatic arch. So the frontal process of this one is in the front. Then below we have the zygomatic arch itself, and this will communicate with one more region here. This is called as the infratemporal fossa. Later we'll discuss about this. So this is the temporal fossa. So the boundaries in the front, in the top will be the superior temporal line. In the front we have the frontal process of the zygomatic arch or the bone, and below we have the zygomatic arch. Okay. What are the contents of this fossa? The main content will be the temporalis muscle, and it's covering fascia which is called as the temporal fascia. So this is the temporalis muscle, and above that it is covered by a fascia. This is called as the temporal fascia. Then deep to that we have the deep temporal nerves and vessels. Then we have the auriculotemporal nerve. Let me show you. So these are the deep to that will be the deep temporal vessels as well as nerves which are there, which are deep to it. Then we can also find the auriculotemporal nerve as well as the superficial temporal vessels. We can see here. So this is the superficial temporal artery. Next to beside that will be the superficial temporal vein, and its terminal branches will be here. Okay, so all these are the contents of this temporal fossa. Clinically, this temporal fossa is important, especially for the surgeons, because they do a surgery called as burr hole operation, or the surgery where they put a hole into a important region here. This is called as pterion. Pterion is a region where the four bones will be meeting. One is the frontal bone, then we have the parietal bone, then we have the temporal bone, and the zygomatic bone. Okay, or the sphenoid to be more specific. Okay, so these are the four bones which will meet at a particular region where it looks like a letter, English capital letter H. So this region is called as pterion. Okay, so this region is very important because deep to that there is one important artery which is passing and very superficially in contact with the bone, the skull bone. So that will be the middle meningeal artery, and this middle meningeal artery is very much prone for injuries, and if there is any intracranial bleeding, usually it will be because of the injury to the middle meningeal artery. So what they do is, if there is intracranial bleeding, okay, if there is intracranial hemorrhage, at that time they do a burr hole surgery where they put a hole into the pterion, and then they catch hold of the middle meningeal artery which is very close to this part, and then they tie it up so that they can stop the intracranial hemorrhage. So clinically, this temporal region or the temporal fossa is very important because of this surgery. Coming to the muscle, the temporalis muscle, this is the temporalis muscle here. So this is a fan-shaped muscle with the origin, which is taking origin from the infratemporal line. We have seen that there are two temporal line. This is the superior temporal line, then we have the inferior temporal line or infratemporal line. So this muscle will be taking origin from the infratemporal line as well as the temporal fossa here. So this is called as the floor of the temporal fossa, this region. So it will take origin from the temporal fossa and it extend up to the infratemporal lines. Okay, so it will take origin from the floor of the temporal fossa below the inferior temporal line or infratemporal line, and it also take origin some part will be also take origin from the temporal fascia, which is outside this, which is covering this muscle. So this is the temporalis fascia, which has been cut so that you can see the muscle itself. So superficially we have the temporal fascia, which will be covering this muscle. So this muscle is bipinnate. Bipinnate means the fibers of this muscle will be running in two directions. Okay, coming to the insertion. So even though the origin of this muscle is a very big one, all the way from the frontal bone up to the parietal bone, going up to the temporal bone. So it has a very big origin, but the insertion is to a particular point. This is called as the coronoid process of the mandible. This is the ramus of the this is the body of the mandible, this is the ramus of the mandible, and one of the part which extend in the front, this is called as the coronoid process. So it will be inserted on the medial side of the coronoid process. All these fibers go and get inserted to a particular point. So it has a big origin, and but the insertion is to a particular point, a small region. So this helps in excessive force can be applied if the muscle has a big origin and the insertion is to a particular point. So it means that it can apply a lot of pressure to this point, and this helps in movement of the mandible, especially the elevation of the mandible. So whenever you are chewing, when you close the mouth, this is the function done by the temporalis muscle. So it helps mainly in the elevation of the mandible, as well as also it helps in the retraction of the mandible, that is pulling the mandible behind, as well as side to side movement of the mandible. When both the muscles on either side contract, the paired muscle, temporalis muscle on either side will contract, then it leads to side movement. So this is the function of the temporalis muscle, and the nerve supply is by the deep temporal branch of the mandibular nerve. Mandibular nerve is the one of the component of the fifth cranial nerve, that is the trigeminal nerve is the fifth cranial nerve, and one of the component of the three division. One of the tri means three, so it has three divisions. So the third division is the mandibular nerve. So the other two are ophthalmic as well as maxillary. Then we have the mandibular component. Then the outside, this muscle, I said outside this muscle, this muscle is covered by a fascia called as the temporal fascia. So this is the temporal fascia what you see. So this is strong sheet of fascia covering the temporalis muscle. So it gives additional support as well as covering to the muscle. The attachment of this muscle is to the superior temporal lines. As I said before, there are two temporal lines. So to superior temporal line is for the attachment of the temporalis fascia, and the infratemporal line and the fossa below that, that is the temporal fossa, is for the origin of the temporalis muscle. Okay, so this temporal fascia is attached to the superior temporal line. Okay, but as it extends downwards, it will be split into two, and it will be attached to the two lips of the upper margin of the zygomatic arch. So this is the zygomatic arch. So it will be attached to the two sides or the two lips of this zygomatic arch. So it divides into two, splits into two layers. Initially it will be just one layer here when it is covering the muscle, but when it comes down, it splits into two, and it attached to the two margins of this zygomatic arch. So within this splitted fascia, there will be some of the contents, like it will contain small quantity of fat as well as the superficial temporal lines. This is the superficial temporal line, vessel, the artery and the vein will be also passing, as well as the zygomaticotemporal nerve can also be traced within this small space within the two layers of the temporal fascia. The importance is, the morphological importance is, it represents the shell of the bone in tortoise. In case of tortoise, this fascia it becomes hardened up and becomes the shell of the So as I was telling you, this represents the shell of bone in tortoise. In case of tortoise, it becomes calcified, hardened, and so that's why it acts as a protective covering. But in case of humans, it is just a thin fascia which covers just the muscle which is deep to end. That is the temporalis muscle. Now going to the next area, that is the infratemporal fossa. We will not discuss in detail about the other structures, because we will cover those structures in some other part of the other lectures, like in case of face and other things. So we will not go into details about other structures. Okay. Then coming to the infratemporal fossa, so it is the area which is below the temporal fossa. That's what is called as the infratemporal fossa. So it is below the middle cranial fossa. So there is the anterior, middle as well as posterior cranial fossa. Then you see the cavity of the cranial cavity at the time. So this is just below the middle cranial fossa, and it is between the pharynx and the ramus of the mandible. This is the ramus, this is the body of the mandible. Here will be the ramus which has been cut, and this will be superficial. Deep will be the pharynx. This is the wall of the pharynx, the three constrictors of the pharynx, superior, middle as well as the inferior constrictor of pharynx. So in between the two structures, superficially the mandible, ramus of the mandible, and deep is the pharynx. In between will be the structures of the infratemporal fossa. So this whole area filled with structures will be the infratemporal fossa. So what are the boundaries? Anteriorly, we can trace the posterior surface of the body of the maxilla. This is the maxilla here. So this is the posterior surface of the maxilla. Then posteriorly, we have the styloid process of the temporal, coming from the temporal bone. So this is the styloid process which form the posterior boundary, as well as the deep inside we can also trace the carotid sheath. Then medially we have the lateral pterygoid plate. So here you can see here. So this is the lateral pterygoid plate. Okay. So this is the lateral plate of the pterygoid process, or the lateral pterygoid plate. Then laterally we have the ramus of the mandible, which, as I said, this is the ramus which has been cut, which will be on the lateral side, and even the process of that is called as the coronoid process. So you already seen this is the ramus of the mandible, and its process that is called as the coronoid process, which form the lateral boundary. So anteriorly we have the posterior surface of the maxilla, superiorly we have the middle cranial fossa, posteriorly we have the, or we can also say, the base of the skull itself. So with the middle cranial fossa to be specific, and posterior we have the styloid process of the temporal bone, as well as the carotid sheath deep inside. Then medially we have the lateral pterygoid plate, and laterally we have the ramus of the mandible, as well as its process called as the coronoid process. And above it communicates with the temporal fossa. Here will be the temporal fossa, and below this is the infratemporal fossa, and these two are separated by this arch. This is called as the zygomatic arch, which has been cut here again. Okay. So what are the contents of this infratemporal fossa? Very important contents are there. One is the lateral pterygoid muscle. Here will be a muscle deep inside, that will be called as the, we'll see the picture. So this is the lateral pterygoid muscle, So the two heads of the lateral pterygoid, upper and lower head. Then medial to that will be, or deep to that will be, the medial pterygoid muscle. So deep inside you can see this is the medial pterygoid muscle. This is the lateral pterygoid, and this is the deep inside in the medial pterygoid. Then we have the lower part of the temporalis. We have already seen the temporalis muscle will be coming here up to the coronal process. So we have already seen this muscle. Okay, so this is the lower part of the corona temporalis muscle, which is coming to the coronal process. Then the mandibular nerve, deep inside we can also trace a very important nerve which is supplying these muscles. So that is the mandibular nerve. So here you can see, here the mandibular nerve shown deep inside. Okay, so mandibular nerve and its branches will be there. Then the chorda tympani nerve will also be there deep inside, as well as the otic ganglion and its contents. Then the maxillary artery and its branches, and the pterygoid venous plexus, all will be deep inside. Okay, so if you see here, this is the maxillary artery in the infratemporal fossa. So that will be the maxillary artery and its branches will be there. Then the deep inside there will be pterygoid venous plexus also. Okay, so these are some of the important contents. One is the lateral pterygoid muscle. So the lateral pterygoid muscle. Then we have the medial pterygoid muscle. Then the lower part of the temporalis muscle. Then we have the mandibular nerve, which you have seen, the mandibular nerve. Then we have the maxillary artery and its branches, lot of branches. Then the chorda tympani nerve, deep inside will be the chorda tympani nerve, as well as even the otic ganglion, which will be also there, which the chorda tympani and otic ganglion will cover in some other lectures. Then the maxillary artery, as I showed already, and the pterygoid venous plexus will be there deep inside. All these are the contents of this infratemporal fossa. Among these we will study the muscles here. Coming to begin with the lateral pterygoid muscle. So the lateral pterygoid, so as I said, it has two heads, the upper head and the lower head. So the upper head will be taking origin from the infratemporal surface and crest of the greater wing of the sphenoid bone. So here is the infratemporal surface, as well as the crest of the greater wing of the sphenoid. Sphenoid has two wings, the greater wing and the lesser wing. So this will be taking origin, this upper head will be taking origin from the greater wing of the sphenoid bone. Then the lower head will be taking origin from the lateral pterygoid plate. So deep inside is the lateral pterygoid. We have already seen this lateral pterygoid. So this is the lateral pterygoid plate. So this pterygoid, lateral pterygoid muscle will be taking origin, especially the lower head will be taking origin from the lateral pterygoid plate. So that's why it is called as lateral pterygoid muscle, because it is lateral to the lateral pterygoid, as well as it is taking origin from the lateral, the bigger head among the two heads. The upper head is shorter, smaller, and the lower head is larger, and it is taking origin from the lateral pterygoid plate. The insertion of this muscle, again the origin is big, but the insertion is to a particular point. This is called as the neck of the mandible. So this is the mandible here, which has been, again the ramus has been cut, and you can see the head as well as the neck. So to go back to these pictures, you can trace here. So this is the mandible, the body of the mandible is the ramus, and here this is the condylar process, or it is also called as the head of the mandible. Just below that will be the neck of the mandible. So this is getting inserted to the neck of the mandible. Again, it has a big origin, and the insertion is to a particular point. So again, the action will be much more powerful. So it will be not only getting inserted to the neck of the mandible, but also the capsule of this joint. This is called as the temporomandibular joint, TM joint. The nerve supply is by the anterior division of the mandibular nerve. Action is the opening of the mouth. Whenever this muscle contract, it will pull the head as well as the neck of the mandible, and it helps in the opening of the mandible. Okay, by pulling the head of the mandible. Second is, as it helps in the opening, it helps in chewing also, along with the temporalis muscle, which helps in closing. Okay, then it also helps in the side to side movement. Okay, so when the muscles of either side will contract, then at that time, alternately at that time, it will be side to side movements. So this is all about the lateral pterygoid. Lateral pterygoid taking origin from two heads, the upper head and the lower head, getting inserted to the neck of the mandible, and nerve supplies by the anterior division of mandibular nerve, and the action is mainly the opening of the mouth by pulling the head and neck of the mandible. It helps in chewing as well as side to side movement. These are some of the features of the lateral pterygoid. Then going to the medial pterygoid. Medial pterygoid is medial to the lateral pterygoid. That's what is called as, or deep to the lateral pterygoid. That's what is called as the medial pterygoid. So if you can see the lateral pterygoid, deep to that is the especially the deep head of the medial pterygoid. The superficial head is superficial, but the main muscle is the deep head, which is deep to the lateral pterygoid. Okay, so that's what is called as medial pterygoid. This is a quadrilateral muscle, as you can see here. It is much more quadrilateral in shape, with again it has two heads, as we have seen, the deep head and the superficial head. Deep head will be taking origin from the lateral pterygoid plate. So again from the lateral pterygoid plate, but it is deep to the lateral pterygoid. It is medial. It will be taking origin from the medial side of the lateral pterygoid. Lateral pterygoid will be taking origin from the lateral side of the lateral pterygoid, and this medial head will be taking origin from the deep to that, from the medial surface of the lateral pterygoid plate. Okay, so that's what is called as medial pterygoid. The superficial head will be taking origin from a particular point here in the maxilla, that is called as the tuberosity of the maxilla, as well as it also take origin from the pyramidal process of the palatine bone. Especially it will be taking origin from the point here, that is called as the tuberosity of the maxilla. Insertion of this muscle is into the ramus as well as the angle of the mandible. This is the angle, this thing is the ramus of the mandible, and this is called as the angle of the mandible. So it will be getting inserted to the medial surface of the angle of the mandible as well as the ramus of the mandible. Okay. Nerve supply is by the mandibular nerve. The actions of this muscle is the elevation of the mandible. Again, this also helps in the elevation of the mandible, just like the temporalis. Temporalis and as well as the medial pterygoid will help in the elevation of the mandible together. And the lateral pterygoid will be helping in the depression of the mandible, that is opening of the mandible, and this medial pterygoid will be helping in the closing of the mouth. Okay, as well as this also helps in the protrusion of the mandible. In case of the lateral pterygoid, it will be the retraction. Okay, but in case of here, it will be protrusion. And it also helps in the side to side movement, just like that of the lateral pterygoid. This also helps in the side to side movement of the mandible. Relations, as you already seen, the lateral to this muscle will be the lateral pterygoid muscle as well as the ramus. This is the ramus and this is the lateral pterygoid. So laterally we have the ramus of the mandible as well as the lateral pterygoid plate. Medial to that will be two important muscles here. These are called as the tensor velli palatini as well as the levator velli palatini. Okay, so these are two important muscles which are there for the palate, as well as even the superior constrictor of the pharynx. If you can see here, so this is the three constrictors of the pharynx, and here will be the superior constrictor of the pharynx, which will be also medial to that. So all these are the structures which are on the medial side, the small muscles as well as the superior constrictor, and on the lateral side we have the lateral pterygoid muscle as well as the ramus of the mandible. So this is about the medial pterygoid muscle. So as we have already seen, just once again to revise, so it has two heads, the deep head and the superficial head. Deep head will be taking origin from the medial side of the lateral pterygoid plate, and the superficial head will be taking origin from the tuberosity of the maxilla, and the insertion will be on the medial surface of the ramus of the mandible as well as the angle of the mandible. Nerve supplies by the mandibular nerve, and the action is elevation of the mandible as well as protrusion as well as side to side movement of the mandible. Relations, superficially we have the lateral pterygoid muscle as well as the ramus of the mandible. So if you can see here, so here it is much more clear. So superficially or lateral to it is the lateral pterygoid muscle as well as even the lateral pterygoid plate as well as the ramus of the mandible. Medially we have small muscles here called as the tensor velli palatini as well as the levator velli palatini as well as the superior constrictor of the pharynx. So these are some of the relations of the medial pterygoid muscle. So this is all about the temporal as well as the infratemporal fossa. We will not go into details about the other contents because that will be covered in some other lecture. Coming to the muscles of the mastications. So the muscles of mastication. Mastication means chewing of the food. So the muscles of mastication are nothing but the muscles which help in chewing of the food. So there are two types of muscles in the face. One is muscles of facial expression. So these are different muscles, and muscles of mastication which are helpful for chewing. So muscles of facial expression will help in the expressing of the different facial features like smiling, laughing, sorrow, everything. Muscles of mastication help in the chewing of the food. So muscles of mastication are only four. That is the medial pterygoid, lateral pterygoid, temporalis muscle as well as the masseter. So these are the four muscles which help in chewing of the food. Medial pterygoid, lateral pterygoid as well as the temporalis as well as the masseter. Among this we have already studied the medial pterygoid and lateral pterygoid in the infratemporal fossa as well as the temporalis in the temporal fossa, and the medial and lateral pterygoid in the infratemporal fossa. The remaining is the masseter, except that all of the other three we have already studied. So totally four muscles which help in mastication, chewing, that is medial pterygoid, lateral pterygoid, temporalis as well as the masseter. All these muscles are supplied by the same nerve, that is the mandibular nerve, as you have already seen. So all these muscles are supplied by the same muscle nerve, that is the mandibular nerve. Muscles of mastications are supplied by the mandibular nerve. So the fourth muscle which is remaining is the masseter. So this is the masseter here. So here also you can see here. So it has a superficial part and deep part. So actually it has three parts. Okay, superficial, middle as well as deep. So this is a quadrilateral muscle, as you can see here, and situated between face and the parotid gland will be here, just superficial. Parotid is a salivary gland which will be superficial just in front of the auricle here. So this is a very superficial muscle compared to the medial pterygoid, lateral pterygoid muscles. So it is a superficial muscle. This is superficial to the mandible itself, the ramus of the mandible. Those were deep to the ramus of the mandible. So the origin of this muscle is from the zygomatic arch. This is the zygomatic arch, so it takes origin from the zygomatic arch. It has a big origin, as well as even the insertion is big. So it will be inserted to the ramus of the mandible, just like that of the you have studied that medial pterygoid. But the difference is medial pterygoid will be inserted to the medial surface of the ramus of the mandible, and this will be inserted to the lateral surface. So this is superficial outside the mandible, that is deep to the mandible. So it will be inserted to the superficial surface of the ramus of the mandible. Nerve supply is by the mandibular nerve, same nerve, so as like the other three muscles. Actions, it is a very strong elevator of the mandible. In some of the books they mention that this is the strongest muscle in the whole of the body, because the strength with which it helps in chewing and breaking of the bones. When you chew, sometimes you can even break the bones in your mouth. So this is because of the strength of this muscle. This is called as the masseter. So it is a strong elevator of the mandible along with the temporalis as well as the medial pterygoid. It also helps in the protraction as well as the retraction of the mandible. This muscle has the dual function of even protraction and retraction, two opposite movements. So this is the muscle which is called as masseter. Clinically, this muscle is important, especially in case of tetanus, where this muscle become tonic or spasm. At that time, this muscle leads to locking of jaw. So at that time in tetanus, this muscle become very tight, strong, and then it helps in it leads to a condition called as locking of jaw, where the oral cavity or the mouth cannot be open because of the continuous contraction of this muscle. This is called as the masseter, and the condition is called as the locking of jaw. So this is all about a brief introduction about the temporal and infratemporal fossa. If you have any doubts regarding this, you can definitely ask or write to me, and I will try to answer. Thank you very much.